I'm Tami Martin, Program Administrator for Butte Cares in Southwest Montana Prevention, and we offer prevention services in 12 counties.
And what is it that you try to prevent mostly?
Yeah, so we are trying to prevent underage drinking and then also drug abuse and misuse. And so, just trying to create a healthier, safer community in all of the communities we reside in.
So you must have a number of programs or...
We do. We actually have a number of different, we have 6 strategies that we work under. And so one of the things that we do is we help to get evidence-based programs into the community. And so we have some programs. One that is fairly, it's new for us, and that's Prevention Plus Wellness. And those are set up for about a 45-minute session. It has an interactive piece for youth to be able to learn because, we learn a little bit better when things are interactive, but it also helps them to set up some goals and give some skills, but it also then teaches them about drugs and alcohol. And what I like is there's actually 11 sessions, and we are doing 5 of those. And one of those is on opioid prevention, and that's really critical right now in our community because of the fentanyl crisis that's in the U.S., but now also here in Montana.
So do you work with law enforcement at all?
We do. We're part of the DUI task force, and so we do work with law enforcement through that. And we also do some different things where we partner with them. There's the National Night Out that's sponsored by law enforcement, and we participate in that every year with them. And so there's that would be one of our environmental strategies too, and so we do a lot of things with that. We do what is called alcohol. It's the responsible alcohol seller server training, and so we go into the bars, or we host for the bars and other people who sell or serve to be able to get that training. It's a training that's required by law, and so we offer that free to the community so that everyone can stay up on that, and that helps. It helps to not serve youth. It also helps to not overserve somebody who's already drinking, and that's really key as well in helping the community and preventing that misuse.
Sounds like a practical approach. So.
It is. Some of it is very practical, yes. We get a lot of information out to the community. So the banner behind me is one of our media campaigns that we have going on right now. And this is actually one where we've partnered with the health department on. And so there's a lot of businesses that are sponsoring the banners, and so they're rotating out to who has it up. We have yard signs for the community members to be able to put in their yard to help bring awareness about that. And then we've partnered with Butte High to do a banner. There's actually a couple of banners that they have. We have another campaign that they're doing, and then we have 2 other campaigns that we're doing. One is called No Joke, and that is for our youth, and it helps to give them some drug and alcohol awareness. And then one is called Parental Guidance Needed, and that helps to just get the information out to parents and helps to encourage them to be able to talk with their kids, because that really is a big key, is parents talking with their children. Dose of Reality is the name of the program that we're doing with the high school. We do everything at a primary prevention level, and so we are trying to get to kids as young as we can, and but also to all of the community and all the parents, of helping them to be able to carry the torch with us, so to speak, in getting that information out. So it's across the board. We work with all spectrums or all sectors of the community to be able to decide, what is it that we're doing and what is our approach going to be. We want to be able to reduce risk factors and then also increase protective factors. And so what we do is a little bit more upstream, for the prevention piece of it. And there's a continuum of care, and we're at the very beginning of that continuum of care. every year, there's Treat Street, and it's been a wonderful resource for our community. And one of the things that we're doing right now, because of fentanyl being an issue, it is showing up in candy. It's showing up looking like candy. There's reports that are coming out where it looks like Skittles in a Skittles bag. And there was a big bust for that in the Northwest, or in the Northeast, I'm sorry. And so people are really afraid. We've had a lot of overdoses here in Montana. We've had some deaths because of fentanyl, and people not knowing that they're taking fentanyl. And then with it showing up in candy and looking like candy, there's been a lot of parents who have said to me, I'm not taking my kids trick-or-treating. Treat Street is what I'm doing this year, and that's the only thing we'll be doing. And so I contacted Ron Davis and I said, hey, you need to know this, because last year they had a huge turnout. And I told him, I said, I think this year you're going to have a bigger turnout. And so one of the things that we're doing is we're trying to partner with him to be able to raise that awareness in the community, and to get the community to help sponsor this event. Last year they ran out of candy. They're probably going to run out of candy on their own this year with what they do, just because of the influx of people who are going to be doing trick-or-treating at Treat Street. It's a big deal, and we don't want people to be afraid. We don't want to be walking around and being fearful of everything.
Right.
But we do need to look at things practically and to say, what can I do? How can I help my child? How can I help, other children too? And which is something too, is healthy risk taking. Sometimes youth are experimenting with different things because, they're youth. They're invincible, right?
Right.
And so it's really important to teach them how to take healthy risks. And so ParentTeamMontana.org is a tremendous support and resource for parents. And it has resources from 0 to 19 years of age for parents. It has information about how to teach your children to take healthy risks. It helps to open up those conversations about drugs and alcohol with your youth, and to be able just really to give them some good tools too. And sometimes that's part of the battle, is that parents don't know how to or what to say. When I was growing up, my dad was always, pick yourself up by the bootstraps, right? Well, what does that mean exactly?
That's right.
And so then I had to go out and do some searching and learning of other things to be able to help my kids. And now I pass the ParentTeamMontana.org on to them and say, here, this is wonderful.
Yeah. So there's a way to channel that without
Yes.
it leading to disasters.
Yes, absolutely, absolutely. So, and we need to have conversations with our kids. And I know that there's a lot of parents here in Butte even who do have those conversations with their kids. And that's really important to do. But the youth also need to know that the majority of youth, they're not using, they're not drinking.
No.
And so there's a lot of support for youth to be able to say no and to learn something different, not to feel like they have to give in to peer pressure, because really the peer pressure is from a small group. It really does. It takes the whole community. And so like even for our coalition, even though we are focused on drug and alcohol prevention, we have people who are in recovery services as well as intervention services who are part of the work that we do, because it takes all of those perspectives
Right.
to come together and to say, here's what we need to do, as well as the youth. We have the youth involved as well with what we do, and help and their input of what needs to happen, what do they want to have.
You guys are the beginning of the continuum, and
Yes.
the courts are probably the end, or the good outcome is part of the end.
The recovery
The diverging
piece. Mm-hmm.
paths,
Yeah, the courts maybe are more somewhere in the intervention piece
Well,
of it.
well, they have that. They have drug court now.
Yes,
don't
they do
So-
have drug court now, and that's something that we're hoping to be able to work more with. There's the youth drug court piece of it with the MIPs, and we're hoping to get to do some more work with them. because I think that there's some really good things that we can be able to bring to that and help those kids too who have MIPs so that they don't continue to get more. If there are youth out there who would like to be a part of what we're doing, they can contact us. We also have a youth coalition that is meeting at East High School as well as Butte and Central, and so they can reach out to the principals there as well. And then also if somebody wants to be involved in the work that we are doing, whether it's even having a yard sign up, they are welcome to reach out to us anytime. They are welcome to come to our coalition meetings. We meet monthly on the third Wednesday of every month here in this building, and our website, our website is ButteCares.org.